Hello everyone, welcome to a new module on CVS Pharmacology. In this video we will study antihypertensive drugs. First of all, let's see what is BP. Blood pressure is equal to cardiac output into total peripheral resistance. If we want to decrease the BP, we need to either decrease cardiac output or total peripheral resistance. So first drugs in this class are diuretics. These are first line drugs used in hypertension from mild to moderate hypertension. Commonly used diuretics are thiazide and loop diuretics. Thiazide diuretics include chlorothiazide and chlorthalidone. Loop diuretics are furosemide, commonly known as Lasix. And these drugs act by decreasing cardiac output. How do they decrease cardiac output? By causing sodium and water loss in the urine. And this effect is initial effect. But in long term, they reduce BP by causing vasodilation. So next class of drugs are beta blockers. These are second choice of first line drugs, which means in the patients in which we can give diuretics, we use beta blockers. Beta 1 blockers are metoprolol, atenolol, pindolol, acebutolol and timolol. These drugs reduce heart rate and cardiac contractility. As we know that on heart beta 1 receptors are dominantly present. So beta 1 blockers act by reducing heart rate and cardiac contractility. Adverse effects of these drugs include rebound hypertension if discontinued abruptly and bradycardia. Rebound hypertension because when we are blocking beta 1 receptors for long term, then cardiac tissue upregulates its beta receptors. So when we discontinue the use of beta blockers, then cardiac tissue is more sensitive to sympathetic innervation. And metoprolol is a preferred drug in diabetics. There are beta 1 plus beta 2 non-selective blockers like propranolol. It is not used because it causes vasodilation in skeletal muscles, which causes fatigability, but it is used in headache. Next class of drugs are alpha blockers. Alpha 1 blockers are prazosin, terazosin, doxazosin. Alpha 1 plus alpha 2 non-selective blockers are phenoxybenzamine and phentolamine. These produce vasodilation and decrease BP. As we know, on blood vessels, alpha 1 receptors are predominantly present, so alpha 1 blockers cause vasodilation. Side effects include postural hypotension. This is because there is peripheral pooling of blood, because on veins also there are alpha 1 receptors present. So when they are blocked, then venodilation occurs and blood flow to heart reduces. So postural hypertension. Reflex tachycardia, because when vasodilation is caused, then due to central nervous system signaling, reflex tachycardia occurs. And phentolamine can cause severe tachycardia. Alpha plus beta blockers are labetalol and carvedilol. These are relatively safe drugs and largely used. Fourth class of drugs is ACE inhibitors. These are very effective drugs. These drugs include enalapril, captopril and lisinopril. These drugs act by inhibiting angiotensin converting enzyme, which decreases angiotensin II levels in the blood. Angiotensin II is a very powerful vasoconstrictor, so decreasing its levels causes good vasodilation. These drugs are preferred in diabetic nephropathy. Side effects of these drugs include dry cough and angioedema. Angioedema is a severe side effect because ACE enzyme is also responsible for breakdown of bradykinin. But when we inhibit ACE, then bradykinin levels go up, causing vasodilation and angioedema. Fifth class of drugs is angiotensin II receptor antagonist. These drugs are without side effects of ACE inhibitors. These drugs block the receptors on which angiotensin II works, so they act directly by antagonizing action of angiotensin II. These drugs include losartan, irbesartan and valsartan. These drugs are preferred over ACE inhibitors nowadays because they have less side effects. Sixth class of drugs is direct acting vasodilators. These drugs directly relax vascular smooth muscles and cause vasodilation. These drugs are in two classes. First one is arteriolar dilators, which are hydralazine, minoxidil and diazoxide. Second class is arteriovenous dilators. These drug is sodium nitroprusside. Side effects of these drugs include sodium and water retention in the kidneys, reflex tachycardia, headache. Hydralazine can cause lupus-like syndrome. Seventh class of drugs is central sympatholytics. These are two types of drugs. First one is clonidine, which is alpha 2 agonist. It inhibits norepinephrine release from presynaptic nerve endings in the vasomotor center. Second drug is alpha methyl dopa. This alpha methyl dopa replaces dopa in presynaptic nerve endings and it gets converted into alpha methyl norepinephrine, which cannot act on sympathetic receptors. Side effects of these drugs include sodium and water retention in the kidneys, drowsiness, headache and dry mouth because central inhibitory effects. Next class of drugs is calcium channel blockers. These are also very powerful drugs. These drugs act by blocking L-type calcium channels in vascular smooth muscles and myocardium. Smooth muscle calcium channel blockers are nifedipine and other drugs. Myocardial calcium channel blocker is verapamil and diltiazem blocks both smooth muscle and myocardial calcium channels. These drugs are relatively safe without side effects like other vasodilators. Ninth class of drugs is ganglion blockers. These drugs are not used anymore because they cause autonomic nervous system depression. Along with sympathetic, they also cause parasympathetic nervous system depression. Example of this class drug is hexamethonium. Then 10th class of drugs is sympathetic neuron blockers. Reserpine, it inhibits dopa uptake transporter in nerve endings. For example, this is the nerve ending. It has norepinephrine vesicles. To produce norepinephrine in these vesicles, it takes dopa. So this reserpine blocks the dopa transporter on the vesicle membrane. Next is guanethidine. It inhibits norepinephrine release from the nerve. It inhibits this norepinephrine release. So that concludes our module on antihypertensive drugs. If you need a lecture on hypertension treatment, drug combinations and treatment of malignant hypertension, please comment below. And if you need any lecture on any other topic, please comment below. I will publish it as soon as possible. Thanks for watching.